So today is day 106, and we were scheduled to drive down to the Kentucky Horse Park today for the Mustang Makeover, which starts tomorrow. And over the past few days, Rumor started looking a little bit off in the hind end at the trot. So the soonest I could schedule a vet appointment was for this morning. Um, and so right now I'm at the vet, and I'm lunging him uh, so that she could kind of evaluate how he's moving. What do you see so far?
We just palpated him so far and watched the video of him under saddle, and it's right hind. Looks like it's localized to the stifle. So just palpated his SI, and it doesn't seem sore right now. He was sore to his right stifle acupuncture point, so we're gonna watch him on the lunge line. We'll try to do some flexions, see if he'll let me do that. We flex the joint and then let him trot and see if that makes him sore. But when they're this age and recently gelded, their ligaments are still kind of tightening and becoming how they're supposed to be, especially on a big beefy horse like this. So sometimes they'll lock their stifles, and it's kind of common to see in geldings and at this age, 6 to 7 years old. So he didn't lock them when you were backing him up, but he does seem sore to that point. So we'll try to localize that a little bit more here in our limbless exam and see. But that's usually something that they either grow out of, need a little bit of anti-inflammatories to calm the ligaments and the sore muscle down, because they will become a little sore in their glutes from trying to stabilize that stifle or knee. So the ligaments eventually usually tighten up themselves, or sometimes you can blister them and you inject a substance in there to try to help those ligaments tighten up a little bit quicker.
So here we're doing a stifle flexion test to see how he moves.
So now we're going to trot him forward?
Yep.
Do you want me to grab him?
Sure.
Okay. Ready? Aim.
Okay.
Are you seeing anything?
Yeah, that was okay.
So it's not his hawk?
You were flexing the stifle there.
Oh, that was his stifle?
Yep.
And the stifle was good or bad?
It irritated him just a little bit.
Okay.
Which makes sense. It's usually
Okay.
a little bit of both.
Okay.
So if we can try to do that on the right side now.
Okay.
He might be a little more resistant. Okay, that's good.
Okay. All right, grab the whip.
Yeah, that's kind of.
You see it? Okay. So we've narrowed it down to...
Narrow it down to the stifle, hopefully muscle.
Okay.
But if you want to just take, let's see if he'll let us take an X-ray. I don't know how that'll go too, because we have to get the plate up in there.
Okay. So do you think this is like a common thing, or?
Yeah, so if it is the locking stifle, it usually happens in bigger breeds of horses, like warm bloods, because they're usually not started until they're about Rumor's age. We don't know for sure that that's what it is, but it does seem like it's in the stifle right now. So whether it's that, or just, a little bit of a pulled muscle or tendon, that's why we'll take the x-ray and kind of rule out that there's any kind of conformational problem or injury to the joint itself. If we don't see anything on the x-ray, then we'll try a couple days of rest and some anti-inflammatories. If it's a strained muscle or ligament, it should start to improve with those things. If we see something on the x-ray, then we can kind of go from there. But as far as the locking stifle, it's not uncommon in larger breed horses about this age, just as they're kind of starting to go into work, especially doing different things like picking up canter leads and bending to different directions.
So we x-rayed his hock, and we also x-rayed his front right knee, because that knee has always been a little bit bigger. And all of the x-rays turned out normal. So this pretty much narrows down the issue to his stifle, which is what the vet initially suspected.
Okay, so this was our first attempt here. Pretty good. We'll try to get one with a little bit in so we can see the joint a little bit better, and then we'll try to get a front to back shot so we can look at the joint spaces. But all in all, don't see anything abnormal here.
Okay.
Potentially a little bit of soft tissue irritation right here, but that's pretty difficult to see on the x-ray.
Okay. There we go. So
He looks good. This is the side where you notice the lateral side. There's just a little bit of soft tissue. Some of them carry more fluid in their knee.
but otherwise it looks good.
Otherwise, the joints, bones, everything looks good.
Good. So Rumor was cleared to participate in the makeover competition, but then after that he would probably benefit from a little rest and some butte. And then later on start on doing some exercises like hill work and stuff like that to strengthen those ligaments. And then over the long term he should be fine.